Do you like going out in the sun? I know I do. But you should be aware that if you spend too much time in the sun, that cancers can occur on the eyelid too. Hi, my name is E-Shawn Goh. I'm a senior consultant, oculoplastic surgeon with Eagle Aesthetic Surgery. I'm here to speak to you for a few minutes about eyelid cancers. Eyelid cancers, thankfully, not terribly common in our population, but they're increasing in frequency, especially as our population is getting older. So if you're worried about your risk of developing eyelid cancers, do a small risk assessment on yourself. If you're on the elderly side, or if you have family history of previous cancers, or you yourself have a history of skin cancers, then you should consider getting yourself assessed. Some patients have medical conditions which may predispose them to getting skin cancers, or for example, if they're immunosuppressed, or they take medications that may suppress their immune system, for example, for rheumatoid arthritis, then they may also be at risk of getting skin cancers. One of the recent trends in aesthetic surgery is the pursuit of fair skin and lightness and all that. That may actually work against you in this instance because the body's natural defense against ultraviolet damage is melanin, and melanin is the pigment in our skin that gives us the color. So if you're always fair-skinned and staying away from the sun, you may actually be lacking melanin. So for the days that you do go out in the sun, you'll be maybe more predisposed to getting sun damage. The ultraviolet damage over time will accumulate and may increase the probability of developing skin cancers. The melanin that we were trying to avoid when we're getting fair skin is actually a protective pigment that protects our skin from sustaining ultraviolet damage. So if you do intend to spend time in the sun, my advice to all my patients is to wear copious amounts of sunscreen. It could be reapplied regularly every 2 to 3 hours, especially if you're going to get wet. Sunglasses are a must, even for myself, and I also wear a hat, especially as you can tell, I like going out in the sun too. So what do you do if you think that you've got a skin cancer or you have a suspicious lesion on your skin? I think the crucial things to look out for are, number one, if you see an abnormal growth on your eyelid that you don't recognize. Number two, if it's persistent and it keeps growing. And number three, if there's a volume or a texture to it. And in addition, sometimes we like to pick at things that grow, and if things bleed and don't resolve on its own by applying a simple antibiotic or steroid ointment, my recommendation is do get it checked out by an ophthalmologist or even a skin doctor if required. If the lesion looks suspicious to a professional, like myself for example, we would usually offer a patient the chance to do a very small skin biopsy. A skin biopsy is a very small surgical procedure that's done under local anesthetic. This allows us to get a very accurate histological or microscopic diagnosis of what this skin lesion is. Thankfully, most of the biopsies that we do are actually benign skin conditions. On the rare occasion that a skin lesion is dangerous or a malignancy, we would, depending on the kind of skin cancer, offer either a limited resection or a wide resection with margin control. So there are several types of skin cancers which we see on the eyelid. The most common types being basal cell cancer, sebaceous cell carcinoma, or less commonly in our population, malignant melanoma. There are other rarer forms of carcinomas, including sebaceous cell carcinomas, but these are exceedingly rare. And sometimes they appear as a chalasia, or in local parlance, a bakzam, which doesn't seem to get better or just keeps coming back after you've gone to see an eye doctor and they've done a procedure, but it just never seems to go away. These are warning signs that your health professional would immediately pick up on, and they would offer you a biopsy. Once an accurate diagnosis is made, we can discuss with you an appropriate treatment plan and hopefully give you a very good chance at a complete cure. Unlike most other cancers, thankfully for skin cancers, early recognition is possible because the eyelids are very obvious. And number two, because of the slow-growing nature of a lot of these cancers, a complete resection and a complete cure is actually a very reasonable outcome that can be achieved for most patients. So if you're worried about the possibility of a skin cancer or a skin lesion that doesn't seem to be improving, please come down, have a look, let us have a look, and we can discuss an appropriate treatment plan, hopefully get you back out in the sun enjoying yourself again.